Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about restless leg syndrome and some of the natural approaches that we have in our office that can help with restless leg syndrome. So let's get into the definition, right? The natural support for restless leg is basically an uncomfortable, unpleasant sensation in the legs that requires the patient to move their legs to try to minimize the sensation. Now, the sensations can be itchiness, burning, tingling, achiness, creepy, crawly sensations. So it can be a variety of different sensations, but essentially the patient needs to kind of move their legs to kind of minimize those sensations. So the traditional treatments for that in the medical world are anti-seizure medications. So why did they use anti-seizure medications? Basically, they're trying to affect brain chemistry, right? Because they feel that restless leg is a result of brain chemistry dysfunction. So they're using anti-seizure medications to help minimize these sensations. Now, sometimes restless leg can be quite debilitating because you're not getting a restful night's sleep. So your sleep pattern will change, you're not getting enough sleep, therefore you cannot heal very well, function very well during the day. So it's very important to understand what the patient perspective is and how they feel. Now, when we look at restless leg syndrome, we know it's neurological because you're getting these abnormal sensations, right? But what people don't realize is that sometimes malnutrition or malabsorption can affect restless leg. In the case of PPI, or proton pump inhibitors, which is a very common antacid medication, right? So they use it for people who have reflux signs or GERD, right? Esophageal reflux disease, right? Burning in the chest when you lie down, etc. So PPI, or proton pump inhibitors, are typically meant to be used short term. I can't tell you how many times patients come in and they're on PPIs for extended periods of time, months, years, decades. So they come in, they're on a PPI for long periods of time. So what does that do? It decreases stomach acid, and you're not able to break down your foods appropriately. And then you end up with deficiencies like B12 and folate deficiencies, right? The average American diet doesn't have a lot of green vegetables anyway. But if you throw in PPIs or antacids, it will decrease your B12 and folate. Also, anemia. In extreme cases, it can create anemic conditions, right? Iron deficiency anemia. The things that you can check are ferritin, serum iron, total iron binding capacity, iron saturation, to look at the numbers to make sure we do not have iron deficiency, right? There is other anemias where it's related to B12 and folate, where you see numbers like MCV, or mean corpuscular volume, go up. So there are other anemic conditions that can occur other than just iron deficiency. Now, why is this important? If you look at different neurotransmitters, there is a neurotransmitter called glutamate. Glutamate is excitatory, makes things fire more, right? It's an excitatory neurotransmitter. Your body has a natural ability to convert glutamate to GABA, which is inhibitory. So this is excitatory, and GABA is inhibitory. It's a relaxation, calm, right? In order to convert the glutamate to the inhibitory, you'll need magnesium and B6, or P5P, right? You need these cofactors in order to convert. You also need B6 to make dopamine, right? Sometimes there's issues with dopamine, another neurotransmitter. In other studies, it shows that dysbiosis, or gut flora dysfunction, or abnormal flora dysfunction, or even infection in the gut can also affect restless leg. So we need to address dysbiosis or leaky gut or intestinal permeability in order for these patients to get better. At the end of the day, about 50% of the patients who come in, we can get better by just giving them B12, B6 or P5P, and folate, right? And then we add in things like magnesium, fish oil, which is EPA, DHA, omega-3s, and an anti-inflammatory diet. So about 50% of the patients we can help just by kind of doing this type of regimen right in here. It's the other 50% that have a hard time, right? Those patients we need to see in office, do a thorough exam, and see what their dysfunctions are. Do they have proprioception, sensation in their legs? Sometimes not just this, it can be also pre-diabetes, insulin resistance, where sugar dysregulation decreases circulation, damages small arteries, nerve tissue. So it can be a variety of different causes. So for those complex patients we see in office, we need to do a thorough exam. We will also do a thorough metabolic panel and blood work to discover whether they have underlying mechanisms. For those patients, it takes a little bit more time. However, like I said, a good portion of patients can get better just on this type of protocol. All right, my name is Dr. Jin Sung. We're at Clinical Excellence Meets Excellent Results, and we'll see you guys next week on the healthy side. Have an awesome day.